Balloons, bazookas, boobies, bosoms, boulders, cans, hooters, knockers, melons, honkers, jugs, rack, tatas, tits, torpedoes, guns, bust, doorknobs, coconuts, and our favorite one, the girls. Welcome to the All About Breastfeeding show, where your host, Lori, highlights mothers just like yourself and goes beyond the surface questions and digs deep so they share not only their joys and happiness in their daily breastfeeding life, but also their pain and struggles and how they worked through them.
Episode number 201. Welcome to All About Breastfeeding, the place where the girls hang out. I am your host, Lori Jill Eisenstadt, IBCLC. I help moms with breastfeeding. If you would like to find out more about the services that I provide or how you can work with me, all you need to do is go to allaboutbreastfeeding.biz and you'll find out a lot of info right there. We have talked about some pretty tough subjects here on this season of the All About Breastfeeding show. Our theme for Season 6 FAQs has been Birth Matters. Where you give birth, how you give birth, when you give birth, it all has an impact on our breastfeeding journey. I continue to receive lots of great feedback on this series. People are telling me that, no, this is not easy stuff to hear, and no, they wish that these things did not occur. However, I am being told just what I suspect. People are saying, as hard as it is to hear about these topics, it's good for me to hear and learn about these subjects so that I am not left out in the dark. You see, for most of us new mothers, one of the most common things we find ourselves saying during times of extreme emotional hardship is, I wish someone would have told me. I wish I would have known. To not mention it at all makes us think that we're crazy when things like postpartum depression or postpartum anxiety happens. We are also really taken by surprise when we have a birth trauma that happens. So, encouraged by you, my amazing listeners, I am continuing on with this theme. If you're new to the show and want to catch up with this theme, you will want to go back to episode number 195. We have tackled such subjects such as postpartum hemorrhage, premature birth, and birth trauma, and their relationship to breastfeeding difficulties. On today's show, we will talk about how interventions that happen during your birth can directly or indirectly affect breastfeeding in the early days. We're going to talk about the choices that are made during your labor and birth. I'm going to preface this discussion by saying that I'm a huge fan of saving babies' lives when they are in trouble. I'm an incredibly huge fan of cesarean sections when they are life-saving. Some mothers want medication, and some mothers have health situations that create a need for medication. I am also going to preface this discussion by saying that I believe it's important for every mother to do her own research about birth. Begin to learn what kind of birth you are hoping for. And as you begin to learn more about birth, you will begin to lean towards the place where you would like to give birth, home, hospital, birthing center, and the kind of provider you would like to attend for your birth. Do you want a midwife? Would you like an obstetrician? Male? Female? Some of these things matter to some people, and some of these things just don't. The important point is that you have choices. And what's going to happen is that you're going to begin to put together a birth plan of sorts, which may include your wishes regarding medications and procedures during your birth. I believe that we can only plan so much, though. We go into labor, we do the best we can to achieve the kind of birth you desire, and at the same time, you also need to be open to birth unfolding the way that it needs to be. There's no judgment about birth and procedures. How can I judge? I'm not you, I'm not in your body, nor am I at your birth. My goal with today's show is to discuss the various birth interventions and how they might affect your breastfeeding experience so that you'll know. There are quite a few birth interventions that may not be necessary, but that do increase your risk factor for having breastfeeding difficulties. Moms want to know this information ahead of time. Anything that causes your baby to be born early, under stress, causes them to need to be separated from you, or under the influence of medication themselves, increases their risk of jaundice or infection. It all has the potential to make it more difficult to ease into breastfeeding in the early days. Anything that causes you to leave your birth experience with a lot of excess fluids, pain from tearing or stitches, pain from cesarean surgery, the need to take medication, it all can affect the early hours and days of breastfeeding, and this is a nice to know. We would like to avoid this as much as possible, as we find that moms can easily get discouraged when breastfeeding is difficult in the early days. It can be quite emotional to struggle to feed your baby. It is quite emotional to be separated from your baby, for them to need to be supplemented, and to see your baby in the NICU, the special care nursery. As a lactation consultant, myself and my peers work with mothers all the time who get off to a really hard breastfeeding start, one that they totally did not plan on. What I'd like to do is go over some commonly seen interventions that may affect your birth. Well, the first one on my list is a planned induction. If you are a healthy mom and your baby is doing fine, try not to induce labor. If your body is not ready yet, inducing labor puts you at greater risk for additional birth interventions. The more this happens, the greater the risk of affecting early breastfeeding. The reasons for this: well, perhaps your baby is born too early and has a weak suck because of his gestational age. Perhaps your contractions are strong because of the labor induction. The pain meds you get to deal with the labor contractions can affect your baby, can cause them to not deal with labor too well, and create a situation where they need to be born quickly, either by forceps, vacuum, or by cesarean section. I'd also like to talk about how you labor. If you're a healthy pregnant mom and there's nothing getting in the way of you being upright and mobile during your labor, you will want to avoid laying in bed for too long. Being active, having the freedom to use the toilet, change positions, walk around, all these help to move your labor along and enable you to best work along with your contractions. Laying in bed on your back for too long can cause fetal distress and failure to progress. Pushing out a baby on your back increases the factor for you having an episiotomy. It also places you in a position that your uterus is compressing the blood vessels that supply the placenta with oxygen. Too little oxygen and stronger contractions sometimes puts a baby into fetal distress. Failure to progress, extreme and uncoordinated uterine contractions, and fetal distress all put you at an increased risk factor for you to have medications that your baby may not handle well. They also increase the risk for you having a cesarean section. Next on my list, I wanted to talk about fasting. Unless there's a medical reason that prohibits you from eating lightly or hydrating during your labor, it is best to do so to help keep up your energy. Labor is hard work, and your body needs the energy to work effectively. Dehydration can mean more painful contractions and slow down your labor. Fatigue, combined with a slower labor, may make a mom who otherwise did not want pain medication feel like she really needs medication because she is losing her stamina to work along with her labor. If you're dehydrated, you are more likely going to need IV fluids. And some women on IV fluids experience fluid overload. Extra fluids in your body tends to cause edema, which can sometimes cause engorgement in your breasts. An engorgement of your breasts can really affect your newborn's ability to latch on properly. Also, engorgement can affect your overall milk supply. One of the common methods of induction is Pitocin. It is a medication that causes stronger, more painful contractions, typically stronger than you would naturally have had. This usually increases the need for you to have further intervention, some pain medication. It also has the potential to make your body retain more fluids, which means more engorgement, which again can have a negative effect on breastfeeding. Pain medications such as Demerol and Stadol all affect your perception of pain, and they also affect women differently. While they usually do provide pain relief, sometimes not enough pain relief, they also cause some moms to hallucinate during their labor. These drugs do cross the placenta and they can affect your baby. It may make babies when they're born too sleepy or show a lack of interest in eating. It may slow down their central nervous system, affecting their ability to achieve a good latch and breastfeed well. When your baby is too sleepy to eat, has no desire to eat, or has difficulty achieving a good latch and transferring milk, they lose weight, and this puts them at risk for jaundice. Jaundice babies are more likely to need to be separated from you, supplemented with milk, other than getting it directly from the breast, and all of this affects your milk supply. Along with the above-mentioned analgesics, some moms choose to, or some moms need to have anesthesia. Common choices are epidurals and spinals. Because there are various medications given during an epidural, it is unknown to what degree your baby will be affected by anesthesia. Next on our list of birth interventions is episiotomy. When you have an episiotomy or even natural tearing, your bottom is sore, and it can be sore, it can be painful, or really, really painful. And you can only imagine that a painful bottom makes it really hard to move and to sit upright with good posture. And this affects your ability to be able to hold and position your baby as well as you might need to. Poor positioning leads to sore, cracked, bleeding nipples. So if at all possible, it would be great for you to avoid episiotomy for more reasons than one. Cesarean section. Well, this is major abdominal surgery. Most people, if they have major abdominal surgery and it wasn't a pregnant mom, well, they just need to take care of themselves and recoup and recover, and it can take quite a few weeks, and they only have to care for themselves. A mom who had a cesarean section needs to care for herself and take care of a baby. Well, this is likely that you're going to need pain medication for at least several days or more after your surgery. Not being able to walk easily, get in and out of bed easily, move your body easily after having a baby can make the early days of breastfeeding quite awkward and more difficult. If the pain medication you're taking is making you sleepy, you might find it difficult to confidently hold your baby and to stay awake while feeding your baby, or for you to get into a comfortable position feeding your baby. Any mom who has had a cesarean section needs to be extra careful in keeping her incision site clean to avoid getting an infection. Overall, studies show that a mom who has a vaginal delivery of a full-term baby without any medication or birth interventions and no mother-baby separation and lots of time together skin to skin, well, they just tend to have an easier time with early breastfeeding. The more birth interventions you have, the more likely you are to have breastfeeding challenges. I felt it's important to share this information and incorporate birth intervention into our series on birth matters, because how you labor, how you birth, has an impact on the early days of breastfeeding. I think you can see this now. A lot can happen in the very first day, and we really want to give you the best chance possible to decrease any breastfeeding challenges. When I meet with moms after their birth, they will frequently tell me they had no idea that medication given to them during their birth might affect their baby's ability to breastfeed. Not ever having done this before, they didn't really fully understand that when babies are separated from their mothers, when babies are born a little early, when babies are supplemented in the early hours after breastfeeding, they just didn't know that all of these actions can make breastfeeding more challenging. Who knows if things could have been different? However, the difference to me is that knowing that they might have challenges and knowing that there are things that they can do as far as prevention and how to help themselves when they do have challenges, this is important for parents to know. Because some moms are just so exhausted and they become depressed easily that they go to bottle feeding so quickly because they just feel like the challenges they're having with breastfeeding are so great and nobody's telling them, that's okay, we can work with it. So they feel that if they don't start off breastfeeding easily, or if their babies are separated, or if they get bottles, that it's too late for breastfeeding. I can't tell you how many emails I get from moms saying, I left the hospital breastfeeding for a day or two, but my baby's had bottles for the last 7 days. Is it too late? I really want to work on breastfeeding. And the answer is, of course not. We can always work on breastfeeding. I have said more challenging that it would be, but I've never said not doable. As I work with moms on a regular basis who work through these challenges, they do need to understand that it might not be easy and it might not be quick. However, many moms will go on to enjoy a wonderful breastfeeding relationship with their baby. And when moms call me or email me with that question, is it too late for us? I often say, if you have a well-fed baby and a good supply, we can always work on breastfeeding. Even if your baby is struggling to feed, even if you're struggling with supply. More challenges, yes, but we can always work on breastfeeding. You may want to listen to episode number 132, where I talk about what you can do to help yourself if your baby is not breastfeeding or is not breastfeeding well. So I really want to educate you on birth interventions and their impact on breastfeeding, but I don't want to leave you feeling like, okay, well, I heard all of that. What do I do if it happens? Episode number 132 is a great show which will give you specific advice on what you can do if you're struggling with breastfeeding. You can be proactive and help reduce further risk factors for greater breastfeeding challenges. In today's show notes, I'll give you a link to a great handout I have that is titled, If Your Baby is Not Breastfeeding or Breastfeeding Well, or You Are Advised to Supplement. I encourage you to take advantage of listening to show number 132 and of getting that handout, even if you don't think it's going to happen to you. At least know where it is, know where you can pull it up on your computer for you or for your partner, that if you do have challenges, you don't have to start searching. You know exactly where to go. All right. Well, I hope that you got a lot of information from this show on birth interventions and that it's given you quite a bit of food for thought. I hope that you do check out the episode number 132 where you can learn lots more detail and that you download the handout I have that's titled If Your Baby is Not Breastfeeding or Breastfeeding Well, or You Advise to Supplement. It's a great little handout that will come in really handy if you should need it. All right, well, I will see everybody on the next show. Bye-bye.